Many of my patients suffer from diarrhea or frequent bowel movements. In most cases, improvement can be achieved relatively easily. Frequent bowel movements must be clarified. Serious diseases may develop, such as Crohn's disease or ulcerative colitis. You also have to look at what the diarrhea looks like. Does it look normal? Does it have blood on it? Or is it rather slimy? Does it have a different colour? There is yellow stool. I have seen orange stool as well. All these questions must be asked carefully. I need to hear from the patient in detail how they suffer, whether it is painful, for example. We all have diarrhea a few times a year, maybe 3 or 4 times. This is completely normal, especially in the summer or when travelling abroad, when we are on holidays and when we're eating other foods. This can lead to diarrhea. This is completely harmless, but if the diarrhea has become chronic every day, you have to run to the toilet several times a day, or if the stool is formed, but you still have to go to the toilet multiple times a day, then something is wrong. We need to take a closer look at that. In many such cases, it is necessary to make a colonoscopy. The doctor will send you to a specialist. Often, you can't see anything. If you don't see anything, it's most likely an irritable bowel syndrome. If the specialist sees something, an inflammatory of the colon for example, then we also see where the diarrhea comes from, and we have to proceed differently. It is also essential to clarify any food intolerances. Many people can no longer tolerate dairy products. Others do not tolerate gluten-containing food very well, especially wheat products. This can lead to a disturbance in the intestinal mucosa, which then reacts with diarrhea. Many other foods can also be the reason for diarrhea, but relatively rare. Dairy and gluten products are clearly on top of the list as causes for chronic diarrhea. Now, how do I treat this? What do I do with these patients? Always provided it is not a serious disease and gastroenterologists ruled out inflammation. It's just diarrhea due to irritable bowel syndrome. Just as important as for constipation is also the case for diarrhea, that you eat enough fibre. The thin stool must be thickened, and that's why you should eat indigestible food. The thin stool must be thickened, and that is why you should eat indigestible food such as vegetables and salad. The colon gets materials that he can bind, that he can make something out of. It is very important to get enough fibre. You also have to know that if you have diarrhea and eat salad, it may even increase the diarrhea in the beginning, but please stick with it and keep eating enough fibre. Please also be careful with medication. Some of us take medications like candy. First and foremost, the stomach protectors. These PPIs, proton pump inhibitors, that block stomach acid, these products are zinc robbers. And when your body has low zinc levels, it can cause diarrhea. Watch out, the hormones, the pill, the hormones in menopause that doctors prescribe are zinc robbers as well, and also a possible cause for chronic diarrhea. Be aware when we talk about treatment, which of these medications you are taking. Otherwise, you have to change them or even abandon them. And the most important treatment substance is the clinoptilolite, a special form of zeolite. This powder from volcanic rock, which has the ability to bind histamine, to bind water, bind heavy metals and easily excrete them through the gut. When I prescribe clinoptilolite to people who have normal bowel movements, almost all of them get constipated. It can be a problem there, but for diarrhea this result is welcomed. So clinoptilolite is the #1 product. It has different names on the market, but that practically always helps when the diarrhea has no further serious cause. Below is a link to a website where we provide more information about the intestines, our therapy plan and intestinal rehabilitation.